Blood clots are a shockingly common issue that can become very serious. Blood clots can be caused by health issues, genetics, medications, or lifestyle choices. Blood clots, also known as deep vein thrombosis or DVT, can form in people who aren't very active or don't move around a lot. For example, full-time drivers may be at risk of getting a blood clot. People who've recently had surgeries might be at greater risk of blood clots. While genetics can play a part in blood clots, if a close relative's prone to blood clots, you might be too. Lifestyle also has a part to play in your circulatory health. While you're never guaranteed to get or avoid a blood clot, there are certain things you can do to make yourself less likely to get a blood clot. On the other hand, certain lifestyle choices and medications can make you more likely to experience a blood clot. It's important to find the balance between natural at-home treatments for blood clots and getting proper medical attention. Blood clots can be extremely serious or even fatal, so you shouldn't rely solely on natural treatments. If you're trying to clear a blood clot at home or just want to lower your risk of developing a blood clot, there are treatments and lifestyle changes you can try right there at home. Our health is directly affected by the foods we eat or don't eat. We know that certain foods are healthier than others, and there are some foods that can improve blood flow and circulation, therefore reducing the chances of blood clots. Turmeric. A key ingredient in turmeric is curcumin, which gives this spice its spicy kick. The curcumin in turmeric helps to boost platelet health, which keeps blood vessels healthy and moving smoothly, therefore less likely to clot together. Turmeric also has anti-inflammatory properties, which can help to ease the pain and discomfort that blood clots can cause. Garlic. Most of us love a bit of garlic. You'll love it even more once you learn that garlic is a vasodilator, which greatly improves circulation. The sulfur compounds found in garlic also work to break down blood clots. For best results, you should consume at least 1 clove of garlic a day. Like turmeric, garlic is a delicious and versatile ingredient, and you should have no problems adding it to your daily diet. Beetroot. Beetroot is an ingredient that turns up in more and more healthy foods and drinks. This is because beetroot is high in nitrates, which are then turned into nitric oxide by the body. Nitric oxide, like garlic, works to promote dilation of blood vessels. Proper hydration. Staying hydrated is absolutely essential for all aspects of health. Dehydration can increase your risk of a blood clot due to the blood thickening and coagulating more. On average, you should be drinking around 8 glasses of water a day, which can greatly reduce your chances of getting a blood clot. Red wine. A little bit of red wine goes a long way. While drinking too much alcohol is obviously bad for your health, an occasional glass of red wine can be surprisingly healthy. Red wine contains powerful antioxidants and can prevent blood platelets from sticking to each other and ultimately clotting. While too much alcohol can be bad for your health, it's perfectly fine in moderation. Olive oils. Olive oil is often classed as a healthy fat. It contains the same polyphenols as red wine, so it can help to prevent blood clots from forming. Virgin or extra virgin olive oil is best. Green tea. While green tea is not everyone's cup of, tea, it's one of the healthiest drinks around. Green tea is packed with antioxidants, anticoagulants, and can even work to prevent deep vein thrombosis. Drinking green tea regularly can help reduce the risk of blood clots. Aspirin. Aspirin is not exactly a food to eat or avoid, but it is a powerful medication you can take at home to help prevent blood clots. This is because aspirin works as a blood thinner, which can prevent blood platelets from thickening and sticking to each other. If you're already taking other medications or you have any concerns, talk to your doctor before taking aspirin on a daily basis. Stay active. Spending all day sitting down puts a person at high risk for blood clots such as deep vein thrombosis or, more dangerously, a pulmonary embolism. For those of us with office jobs, this can be tricky. We might spend all day sitting down. However, sitting all day is the perfect recipe for poor circulation and sluggish blood flow. To get your blood moving, you need to get yourself moving. Exercise is essential. You don't need to join a gym or start jogging for miles every day. If you've led a fairly sedentary life until now, start with gentle exercise. A few minutes of walking a day can help ease you into the habit of exercising, and you can gradually increase the pace of the walking and the distance that you travel. The key is to get your heart moving. The faster your heart pumps, the more blood flow you're getting around your body. With regular, vigorous blood flow, a person is at a far lower risk for blood clots. Wear the right clothes. If your legs or arms are prone to swelling, a doctor might recommend compression stockings or some other sort of compression garment. Compression stockings can help to deal with swelling and manage blood flow in your extremities. However, you do need to find the right balance here. In most cases, wearing tight-fitting clothing will put you at greater risk of developing deep vein thrombosis, not less. Wearing compression clothing during and directly after exercise is fine, but for the rest of your time, it's better to wear loose-fitting clothes. Tight clothes may look good, but they're putting you at a greater risk of deep vein thrombosis or blood clots. Skinny jeans and tight tops are fashionable at the moment, but they can actually cause poor circulation, which can lead to blood clots. Last but certainly not least, you need to find the right balance between at-home treatments and medical care. A blood clot is not a case of flu for you to try to treat at home. A pulmonary embolism can be fatal. If you suspect you have a blood clot, it's best to get it checked out by a doctor first of all. Most of these at-home treatments can be used alongside prescribed medication and treatments. In fact, most doctors suggest taking an aspirin a day to help reduce the chance of blood clotting. Remember, making healthy lifestyle changes is always the right thing to do. Eating badly, not exercising, smoking, and excessive drinking can all seriously increase your risk of getting a blood clot. Making changes in your lifestyle now can make all the difference. You may be at greater blood clot risk if you've just had surgery or if you have a sedentary lifestyle. If you have a health condition that prevents you from moving around very much, you might want to watch out for blood clots. Finally, here are a few symptoms that could indicate that you're suffering from a blood clot. Swelling in the arms and legs, redness or discoloration on your extremities, shortness of breath, warm spots in certain areas, particularly on your extremities, pain or discomfort. This can be localized or can pop up in other areas, but is usually connected to the clotting. If you think you might be suffering from a blood clot, then seek medical attention immediately. I hope you've enjoyed this video. If you have, please subscribe to this YouTube channel and don't forget to give this video the thumbs up. And I'm sure you're going to enjoy our next video on the top 9 foods to purify your blood naturally. Thanks for watching, and bye for now.